Not a new developments in the fight against the coronavirus. The White House is putting an end to the COVID public health emergency.
That's right. The Biden administration's emergency declaration will end on May 11th. This as the country looks to get away from treating COVID as a national crisis and instead go toward treating it like a seasonal illness.
So exactly what does all this mean? Well, NBC News medical fellow Dr. Akshay Syal is here with us to help us understand. Always good to see you. Good morning. So what does ending this emergency declaration mean exactly? How's it going to impact someone at home?
It's going to have a lot of impacts. It was a time coming. I don't think this is a surprise to a lot of people, and to the administration's credit, they've given us 3 months here to sort of figure things out. But what will this mean? Over the past few years, because of this public health emergency declaration, we've seen things like vaccines and testing and treatment. As a doctor, I've not had to worry about the cost when prescribing these things or asking patients to get these things. I haven't really had to worry how much will this cost them. And that's kind of the big thing, and that's sort of what we're looking at. But there's some other things as well. Telehealth expansion, that was something we saw over COVID. A lot of people couldn't make it to their doctor, so they started doing video visits, and we could bill for that. But as the public health emergency goes away, that's another thing we're watching for as well.
And it's so hard, right? Because you can't talk about health in the U.S. without talking about insurance. And I know coverage around Medicaid surged during COVID, and Congress actually blocked insurers from sort of blocking patients from getting coverage just because they had COVID. What's the state of all that?
It's the underinsured and it's the uninsured that we're really worried about here. Those with private insurance are probably going to be okay. We're not really worried about, can they access vaccines and testing and treatments. It's really the underinsured and uninsured. So Moderna and Pfizer have said that the vaccine going forward is probably going to cost about $100. And so for somebody who can't afford health insurance, asking them to pay $100 for a vaccine it's going to be tough. And that's, one thing we're really worried about as well, the underinsured and the uninsured.
So, Doctor, what about new strains popping up, or if we do see a spike in cases, what does this new sort of categorization mean in our response to that?
Yeah, the big thing to watch for here is every time there was a new strain, we updated the vaccines once, but we've also updated things like monoclonal antibodies. We've authorized Paxlovid, the antiviral drug. So as this public health emergency goes away, are we going to continue to see those emergency use authorizations, those temporary measures to allow access to new treatments for those new variants, or is it something that we're going to have to go through the formal FDA approval process, which, as you know, takes a lot of time, and as variants pop up, may not be something that we can do so quickly.